The University of Michigan Adolescent Health Initiative created the Adolescent Champion Model to help health centers become adolescent-centered medical homes. Our Teen Advisory Council created a video that helps paint a picture of some of the ways a health center can be welcoming to teens. Let's take a look.
Hi, I'm Julie.
I'm Brandon.
I'm Clara.
And I'm Felipe.
We're here to talk about some ways that health centers can meet the needs of teens and young adults through things like physical space, policies, and personal interactions.
There are tons of ways to help teens feel welcome. Here are some of our ideas.
For some of us, getting to appointments can be challenging.
Having bike racks outside can make it easier for when we don't have transportation.
Posting hours outside your clinic is important, and make sure you have times after school hours so students can get there too.
It can really help some of us with unpredictable schedules if you accept walk-ins.
And if we happen to run late for an appointment, please try not to make us feel like we've broken the law.
The more comfortable we feel, the more we'll want to come back, which will help us get better health care.
Your waiting room matters. It's our first impression and a place where your teen patients will have to, well, wait. But hopefully not too long.
And waiting means sitting, so why not have comfortable options for all shapes, sizes, and ages?
I know doctors' offices are for little kids, but they're for teens too.
Why not show a diversity of styles and types of artwork?
And maybe even feature some pieces by local teen artists.
I'd like that.
Real plants are great too, but if they don't look taken care of, it makes me feel like I might not be either.
Magazines are standard in any waiting room, but why not have some that are geared to teens, like 17 or Electronic Gaming Monthly?
No, I want Mad Magazine or J14. Or Wi-Fi. I'd like the Wi-Fi password posted even better.
Hey, what about magazines in other languages? Y servicios de traducción en otros idiomas sería aún mejor.
Yeah, also show that the space is safe and inclusive of LGBTQ plus youth, such as a rainbow sticker on the door.
Teens can have pretty different interests, but one thing that matters to all of us is privacy.
Definitely. Having some kind of dividers at the reception counter can help keep us comfortable when we share private information.
I've even been at a place that had a white noise machine to make it hard to overhear.
As much as we love the reception area, we're really here to get into the exam room.
Of course we expect it to be clean and professional, so what matters most is our interaction with our doctor.
This means we're getting good eye contact, non-judgmental listening, and welcoming body language.
Having your confidentiality policy clearly posted in the room really helps us feel comfortable being honest.
And so is doing check-ins throughout our appointment to make sure we're on the same page.
Remember, not all situations are the same, and not all teens are the same. When in doubt, ask us.
Why is this important? Why should health centers focus efforts on adolescents when they may just be a small portion of their patient population? As the National Resource Council states, adolescents face gaps in care, fragmented services, and missed opportunities for health promotion and disease prevention. In healthcare, it can feel like they are a lost population, as primary care providers often don't go into their field to work with teens. Additionally, most large-scale initiatives for this age group are focused on very specific issues, such as teen pregnancy prevention, bullying, and suicide prevention. There are few efforts to address adolescent health as a whole. Let's briefly discuss some of the barriers to adolescent healthcare usage and engagement that widen this gap in care. One of the most concrete things people think of when they hear adolescent health home is physical space. As the teens in the video said, they want to feel as though their doctor's office is a space that is inclusive of them. If there are only toys for toddlers and magazines only for adults, teens may feel as though they are not welcome in this space. Physical space, though, is just the tip of the iceberg. Let's discuss some other components that create this gap in care. While only 7% of physicians believe their teen patients are interested in their physical health, 96% of teens believe that it is important that they are in good health. This can lead to a lack of communication between adolescents and providers, and this is one of the biggest contributors to health disparities facing adolescents. Adolescents care about their health, even if they don't always seem like it. As one teen put it, "We want you to talk to us, not about us." Another gap in care is that providers may struggle with consistently implementing best practices and recommended standards of care for adolescent patients. National surveys of physicians, nurses, social workers, and other health professionals have identified gaps in self-perceived skills, competencies, and training related to adolescent health. Many academic programs and professional development opportunities don't include significant emphasis on adolescents' needs and development. A strengths-based approach reminds us that it is developmentally appropriate for adolescents to engage in sensation-seeking behaviors. This sensation-seeking is important and can help teens develop their identity and find out what they are passionate about. Adolescents may try positive, novel experiences like snowboarding, volunteering at an animal shelter, performing at a poetry slam, or building relationships. There are emotional risks, physical risks, and social risks, all of which play an important role in acquiring skills of independence as they transition into adulthood. Sensation-seeking can also lead to more dangerous risk-taking, like smoking, drinking, or having unprotected sex. In fact, more than 70% of illnesses, disabilities, and deaths among adolescents are caused by health behaviors. This rate of morbidity and mortality related to behaviors is disproportionately higher among adolescents than any other age group. So we know it is expected for adolescents to engage in risky behaviors, both healthy and unhealthy. But studies have shown that in a primary care setting, less than 20% of adolescents receive screening and counseling for these behaviors. When adolescents aren't screened, opportunities are missed for intervention, prevention, and health promotion. Ensuring confidentiality is very important in risk screening, but also in establishing an open and honest relationship with providers. Research shows that while adolescent patients are unlikely to bring up sensitive issues with their providers on their own, they do want to discuss these subjects. Teens cite concerns of confidentiality as one of the biggest barriers to seeking health care. However, physicians have been found to have low knowledge about the laws that exist in their state regarding a minor patient's ability to consent for healthcare services. Studies also show that adolescent patients and their parents are often unaware of minor consent laws as well. Although not all adolescents require confidential care, some teens want to know what they can discuss with their providers without it getting back to their parents, and what services they can seek without their parents knowing. Here is a teen recounting an experience she had around confidential care.
So last time I was at the doctor's office, my mother was in the room every time I would answer a question. And I had no idea what I could or could not consent to, and it made me feel like I had no control over what was happening to me or my healthcare or my own body.
Now that we know a little more about the gaps in care that adolescents face, let's talk about what can be done to bridge those gaps. The Adolescent Health Initiative created the Adolescent Champion model to drive health centers to become adolescent-centered medical homes and bridge the gaps we discussed, making common practice best practice. Before we jump into the Adolescent Champion model, let's define an adolescent-centered medical home. An adolescent-centered medical home is an environment in which adolescents receive care when, where, and how they need it, in a manner that is respectful of and responsive to their preferences in a way they can understand, empowering them to participate in decisions of their care. These principles are the hallmark of patient-centered care, and the Adolescent Champion model applies these specifically to the adolescent patient population. AHI created the Adolescent Champion Model to drive health centers to become adolescent-centered medical homes. The Adolescent Champion Model achieves this through 5 main strategies. The first component of the model is the Adolescent Champion Team, which includes a provider and health center manager and additional interested staff such as a medical assistant, social worker, or nurse. This champion team collaborates to drive improvements within their health center. Champion teams also instate this model with a cohort of champion teams from across the country. This provides opportunities for sharing strategies, resources, and success stories. AHI provides training and professional development to champion teams on core content areas for adolescent healthcare, as well as trainings on leadership and organizational change. Teams participate in these professional development opportunities, which prepare them to drive improvements within their health centers. The next component of the Adolescent Champion Model is Sparks. Sparks are mini trainings that the Adolescent Champion teams facilitate for the entire health center. They are meant to spark ideas, discussion, and reflection around specific topics related to adolescent healthcare. Here's one adolescent champion, Dr. Amy Locke, talking about her experience with Sparks in her health center.
I think it's really been a powerful experience to see staff that, with pretty small amounts of training, have such dramatic differences in comfort levels.
The Adolescent Health Initiative developed a comprehensive self-assessment tool for health centers to complete, painting a picture of a site's adolescent-centeredness. Adolescent champion teams complete this clinic self-assessment together and score themselves on each line item within each section. The assessment includes 12 sections covering the following themes: access to care, adolescent appropriate environment, confidentiality, best practices and standards of care, reproductive and sexual health clinical practices, mental health clinical practices, nutritional health clinical practices, cultural responsiveness, staff attitude and respectful treatment, adolescent involvement and empowerment, parent engagement, and finally, outreach and marketing. The assessment involves numerous metrics within each section, leading to a thorough view of the clinic's adolescent-centeredness. Let's take a deeper look at a few sections to get a better idea of this. The Access to Care section addresses a number of different concepts that impact access. Cost of care can be a major barrier to adolescents in seeking health care, so it is important to have someone to guide uninsured patients through the Medicaid enrollment process or help them sign up for other insurance options. Additionally, teens may have difficulty seeing a provider during traditional office hours. Some centers offer flexible hours, including some evenings and weekends. This will allow teens to seek health services after school or extracurricular activities. Access to care is an important area to highlight because adolescents access health services at a lower rate than any other age group. The Adolescent Appropriate Environment section focuses on physical space. Remember what the teens said in the whiteboard video. Doctors' offices are for kids and adults, but they are for teens too. For instance, artwork that is appealing to people of all ages and magazines that are interesting to teens can go a long way in making adolescents feel welcome in a space. The confidentiality section is one of the most important, as a perceived lack of confidential services can be a major barrier in adolescents accessing healthcare. A posted confidentiality policy can help teens and parents know what to expect and what is available to them. In addition to a confidentiality policy, health centers should provide training to providers and staff to ensure that they are knowledgeable about laws regarding a minor's ability to consent for specific services, as well as when parental notification is mandated. The Best Practices and Standards of Care section addresses those gaps that have to do with the actual provision of healthcare. This involves reviewing immunization records at every visit and updating immunizations as needed. It also means that adolescents complete a confidential standardized screening tool to assess for risky behaviors, allowing providers to get the information they need to tailor the visit. Let's hear from a provider about her experience implementing standardized confidential risk screening.
So at first, when we were going to implement risk screening in our clinic, I was a little skeptical. You know, I always speak to my teens confidentially, and I think our conversations go really well. I didn't know if it would really be helpful or if it would just take up more time. However, within a week, I was really pleasantly surprised. First example is a teenager who had circled yes to they circled the question on their risk screening questionnaire. During the past month, do you often feel sad or down as though you had nothing to look forward to? And he wrote yes to that question. And I went in and spoke to him confidentially and asked him, when I talked to all teenagers, you know, have you ever felt down or depressed at all recently? And he just looked at me and said no. I was surprised. So I really just remembered the questionnaire. We remembered that he said yes, so all I did was reword it. I said, well, have you felt happy at all recently? And he looked at me and said, no, honestly, I haven't been happy for the last 5 years. And I was floored. I mean, just by simply rewording a question, I was able to uncover lots of problems and some pretty severe depression that this teenager had, which I really do not think I would have caught unless I had that risk screening going in.
Another section in the assessment is cultural responsiveness. This involves health center staff and providers receiving regular staff training on sexual orientation, gender identity, and cultural responsiveness, including cultural norms specific to the patient populations. Another point to consider is striving to hire a diverse staff in regard to both ethnicity and gender. As one adolescent development expert has stated, making sure we are culturally responsive is especially important when we work with teens, because they may already be treated as less than by adults. Staff attitude and respectful treatment can be represented in a number of ways and has significant impact on a patient's experience. Ideally, all staff and providers receive training in treating adolescents respectfully with a non-judgmental approach, and they avoid using medical jargon when communicating with patients. That is a general overview of AHI's self-assessment tool used to measure a site's adolescent-centeredness. When adolescent champion teams complete the self-assessment, they select priority areas to focus their efforts over the course of the project. AHI provides health centers with a planning tool with robust resources and recommendations based on the areas of improvement the site has prioritized. AHI is here to help sites every step of the way so that these changes are manageable and impactful. The Adolescent Champion model drives patient outcomes, including overall improvement of the quality of care provided to adolescent patients, improved HEDIS and performance measures specific to the adolescent population, and improved adolescent patient satisfaction. For providers and staff, the Adolescent Champion model strives to improve knowledge and attitudes in caring for adolescents, provide opportunities for involvement in quality improvement initiatives, and provide leadership opportunities. The health center outcomes that the Adolescent Champion model drives include professional development for staff and providers, including continuing medical education, or CME, and maintenance of certification opportunities, and meaningful improvements in clinic appearance, policies, and procedures. That is AHI's Adolescent Champion model and an overview of the main components driving health centers to become adolescent-centered medical homes. We have made our way through identifying the gaps that adolescents currently face in healthcare, to defining an adolescent-centered medical home, to discussing AHI's Adolescent Champion model, which drives health centers to bridge this gap between common practice and best practice. We hope that through this process, you've identified some ways to make your health center more adolescent-centered. If you are interested in learning more about the Adolescent Champion model, please contact the Adolescent Health Initiative.